Hi, my name is Bertrand Dirk, the Director and Founder of the Brisbane Headache and Migraine Clinic. Now today we'll be discussing about tension type headache. Do you suffer from tension type headache? What is the cause? And how can you best manage these symptoms? Now according to the International Headache Society, tension type headache is the most common type of primary headache, which accounts to almost 90% of all headache types. It has a lifetime prevalence worldwide ranging up to 78%. Now, tension type headache is usually felt by a constant pressing, tightening or squeezing discomfort on both sides of the head. Sufferers normally describe their pain as if they were wearing a very tight helmet which can become tighter and tighter around their head. Now, the pain intensity can range from mild to moderate and can last anywhere between 30 minutes and up to 7 days. Nausea or vomiting is not a feature of tension type headache, however, sensitivity to light or sound can be. Although the pain intensity ranges from mild to moderate, it can still leave those suffering from this condition to become disabled due to the constant, annoying and long-lasting nature of this condition. Now, there are two types of tension type headache. The first one is called episodic tension type headache. This is characterized by the frequency of attack days per month. It usually occurs if the person suffers from this less than 15 attack days per month for at least 3 months. Also, episodic tension type headache can last anywhere between 30 minutes to 7 days. Now, recent international research have found the average prevalence is 36% for men and 42% for women. If episodic tension type headache worsens over time, it may then transform into chronic tension type headache, which is the second form. Now, chronic tension type headache is characterized by having 15 or more attack days per month, which has to last for at least 3 months. Now, for some sufferers, they may have a continuous headache that lasts all day for 10 to 30 years or more. Now, chronic tension type headache is usually resistant to painkillers and can at times, sufferers can also experience migraines in conjunction with their chronic tension headaches. Now, tension type headache is different to migraines and sufferers are often incorrectly diagnosed. Most people may not understand the difference between the two and often use both terms to label their headaches incorrectly. Tension headache will have mild to moderate pain, whereas migraines is usually more significant and can reach up to severe debilitating pain. Tension headache is usually felt bilaterally on both sides, whereas migraines is usually unilaterally and felt on one side of the head. Tension headache does not get worse with normal everyday today activities and movements. However, unlike migraines, simple movements, activities, work or even sports can often exacerbate and worsen their migraine. Also, tension type headache do not have nausea or vomiting, whereas migraine do. So, what is the cause of tension type headache? Now, the traditional and old theory of the cause of tension type headache was due to an increase in muscular tension around the head and scalp, causing a tension type headache. Now, this theory was proved wrong in recent studies, as researchers have found the tension in the scalp from those with tension type headache to be no greater than those who do not suffer from this headache. Recent research and discoveries have found, though, that the primary contributing factor for tension headache to be related to the neck and predominantly a fault in the upper cervical spine, resulting in a sensitized brainstem to induce these headaches. Now, interestingly, studies as early as in the year 1977 have found through EMG that the scalp muscle activation actually do not change. However, the muscles around the neck showed increased inactivity, thus indicating a fault within the neck with those suffering from tension headaches, rather than tension around the head. So, what can you do to help with these tension type headaches? The question to ask you is, have you had your neck thoroughly assessed through a headache clinician? If not, we highly recommend that you visit a dedicated headache and migraine clinic to identify the root and underlying cause of your tension type headache. The other question is, have you had your brainstem assessed to see whether that is the cause of your tension headache? If not, we urgently recommend that you do see a headache clinician. Hopefully today you have understood more about tension type headache, what they are, what the cause is, and what you can do to help manage these symptoms. My name is Bertrand Dirk from the Brisbane Headache and Migraine Clinic, and I look forward to seeing you in our next video. Thank you.